So let's talk about the natural history of congestive heart failure. So is this something that you get and you can take some medications and you're cured, it goes away? Or is it something you have for a while and progresses?
So it depends upon the etiology. So if the etiology of congestive heart failure is a structural problem, let's say it's coronary artery disease with blockages and you had a heart attack and an area of the heart muscle now has been substituted by a scar tissue, chances are that you're not going to recover fully or you're not going to improve fully. You're going to need some sort of chronic treatment to manage the chronic increased pressure in your heart. Occasionally, you may have cases such as an acute viral infection or cases like a stress-induced cardiomyopathy where a patient may have a sudden stress and an adrenergic rush that could lead into weakness into the heart muscle. And in those patients that had an acute injury, there is a good chance that they could recover. The general rule of thumb is that 30% of patients will recover their heart function completely, 30% will remain about the same, and 30% could continue to decline rapidly. But if there is a structural problem like a leaky valve that is leading to congestive heart failure or coronary artery disease, then chances are that the disease will progress over time, although medications have shown to slow the progression significantly. So if you have a heart attack, let's say, and you follow the right medications, let's say your disease was to progress to be terminal in 5 years. We could slow the progression in a way that now is terminal in 30 years. And if you're 60 years old, 30 years is more than enough to complete your lifespan, in spite of not being cured from the disease. But depending upon the etiology, some of them could recover completely. Most of them need some sort of chronic treatment in order to maintain the disease process or to slow it down to a degree that will not interfere with the longevity.
So it really depends on what led you to have the heart disease.
Depending upon the etiology will be the prognosis. There are situations such as amyloidosis, which is an infiltrated disease of the heart, which the progression could be rather rapid. Or conditions such as sarcoidosis, occasionally they could be rapid too. There are some sort of autoimmune myocarditis that could also progress very rapidly. So most of the time we are able to identify the etiology, and once you know the etiology, you have a better idea about the prognosis. Chances are that in the community you're going to be dealing with patients with coronary artery disease or with idiopathic cardiomyopathy, which are chronic conditions.
Is there any sort of scale or classification of severity of heart failure that you use?
So the New York Heart Association heart failure classification has been the one that we use the most, and it's very simple. A class 4 heart failure is an individual that is symptomatic at rest. You're doing nothing and you're short of breath. That's a class 4 heart failure. A class 3 heart failure is somebody who at rest is not symptomatic, but with minimal activities of daily living, such as combing their hair or brushing their teeth, they are already short of breath. Then a class 2 heart failure is somebody who could do his activities of daily living without being short of breath, but when they exercise a little bit beyond or when they move or start walking around, then they have the symptoms. And a class 1 heart failure is somebody that will get, they could do their activities of daily living, but at certain levels of exercise, they do get a short of breath. So that has been the classification that we use the most. And that classification is associated with mortality. So if you are a class 4 heart failure, your average survival rate at 6 months is 50%. So, and every 6 months is a new gamble whether or not you're going to be around or not. While your survival rate when you're class 1 or class 2 heart failure is pretty good.
Do you see much of so there's clearly a progression, so you can get worse. Once you've graduated, if you will, to say class 3, do you ever come back down to a class 1?
So again, it depends upon the etiology. It depends upon your compliance with certain medications. You could move patients from a class 4 heart failure to a class 2 or class 3 heart failure with medical therapy. You can move them also with device therapy. So if somebody has weakness in the heart muscle and they are class 4 heart failure and they have a left bundle branch block, let's say, there is the synchrony in between the left ventricle and the right ventricle. You optimize their medications. These patients should be in a very good dose of a beta blocker, the highest tolerated dose of an ACE inhibitor. They are probably in a diuretic since they are having fluid congestion. And with that alone, you may move somebody who is class 4 heart failure to a class 3 heart failure. And then if they have this synchrony and you implant a special pacemaker that gives biventricular pacing, You could synchronize the heart and then potentially move somebody who was class 4 even to a class 2 heart failure. So there is a room for improvement, and some patients that have been class 4 with appropriate medical therapy and with appropriate compliance, fluid restriction, sodium intake restriction, and device therapy could significantly improve their functional class.
So compliance there's a pretty good carrot at the end of this path for a patient who decides to comply with the therapy. They can really see a lot of improvement.
Absolutely, and the other part is true. If you do not comply with the medication, your chances of getting away with this are very low. Salt restriction and water restrictions are very, very important. If your heart is already having hypertension inside of the chambers, that is what is leading to the pulmonary congestion. If you increase your sodium intake and your fluid intake, then that pressure will be higher and it will leak to the lungs, causing the shortness of breath, or to the legs, causing the edema.